Good evening, everyone. Dr. Stacy here. I am so excited you decided to join us this evening. I have a returning guest tonight. Dr. Adam Scheiner is back again. It's been a year. Can you believe it? Wow, this year it's flown by. But I know that you guys are going to be so excited with his PowerPoint with what he has to share. He's already shared videos with me and pictures, so get your notepads ready. I'm going to give you just a little bit of information about him because I really want him to take as much time as possible. And of course, at the end, he's going to be answering any questions that you have. So let me just give you a little bit of information about Dr. Scheiner, okay? So he is highly respected as an eyelid and facial plastic surgeon at the forefront of laser cosmetic surgery. He is world renowned for developing innovative techniques for facial rejuvenation. Dr. Scheiner's practice has delivered 25 years of patient transformations. He's a published author and a researcher and an educator who speaks at national and international conferences. Dr. Scheiner received his medical degree from the University of Pennsylvania and completed his internship at St. Barnabas Medical Center in New Jersey. He completed his ophthalmology residency at the University of Pennsylvania's Scheiner Eye Institute and then continued his studies again during an ocular plastic and laser facial aesthetic surgery fellowship with Dr. Sterling Baker, the pioneer of laser eyelid surgery. That in of itself is absolutely amazing, but it doesn't stop there. So over his years of practice, Dr. Scheiner has perfected using the laser in eyelid surgery, improving on what he'd learned from working with Dr. Baker. He began doing what others thought impossible, treating eyelid festoons and malar mounds, and pioneered a deep resurfacing procedure called reset festoons. His practice has become internationally renowned for its astonishing results after he demonstrated the reset festoons procedure on the Dr. Oz show and The Doctors. So as a dedicated researcher, Dr. Scheiner continues to improve and innovate new laser and resurfacing techniques. Though he was pleased that his upper lid laser, oh boy, that's a big word, surgery, I'm going to let you do that one, Dr. Scheiner, removed excess skin and fat, eliminated heaviness or hooding, and created slight tightening, he was dissatisfied that the eyelid skin left behind was still looking wrinkled and crepey. So knowing the results he delivered with reset full face and reset festoons, he set out to find the levels of laser that would safely produce those same results for the eyelids. The research took years, but the results was worth the wait. His latest innovation, the reset upper lid procedure, virtually erases old skin, making room for new healthy skin and providing remarkable improvement. It offers complete upper eyelid rejuvenation. Dr. Scheiner's other professional accomplishments include co-authoring book chapters on laser eyelid surgery, presenting original research on the use of lasers for cosmetic surgery at national and international scientific meetings, and lecturing for other physicians on the use of lasers for surgical procedures. Dr. Scheiner is based in Tampa, not too far from where I am, where he provides expert care for patients from throughout the United States and around the world. He is the author of the Wall Street Journal bestseller, The True Definition of Beauty, has been interviewed by the New York Post, and has made multiple media appearances, including the Dr. Oz Show, The Doctors, and the Howard Stern Show. So before I let Dr. Scheiner take over, I want to make sure you understand with all that incredible information, expertise, knowledge, and what he is going to share with you today on LifeWave's technology, the information that we are sharing about LifeWave is for informational purposes only. Myself nor Dr. Scheiner is here to claim to treat, cure, diagnose, prevent any diseases at all. We are not your medical doctors. He's a medical doctor. You guys know me. I'm a PhD. So we are not your physicians or practitioners. Please check with your doctors or your healthcare practitioners if you have any questions regarding your health. So with that, Dr. Scheiner, please take it away. I want you to have full access to screen share everything you need to just fill our cups tonight.
That's awesome. Stacy, thanks so much for inviting me to come talk to your group again. I'm very excited about share. I have some new things to share since the last time we talked. So let's get started here. And then I'm definitely open to answer questions afterwards for people. Okay. Is that coming across okay? Okay. And you can hear me?
Everything's perfect. Absolutely.
Very good. So this is our longevity and wellness seminar that I'm doing with Dr. Stacy, and I'm going to talk about my practice a little bit and then how and why I started using the X39 for my patients. Let's see. There we go. So, my background, I come from I think it's nice to know where your speaker's coming from. I come from the Northeast originally. I went to college at Rutgers. I went to medical school at the University of Pennsylvania. I did my residency there, and I went out to Oklahoma City, and it was mentioned this person, Sterling Baker, who is really the pioneer of using lasers at the time. I trained with him, and I've been private practicing now for the last 24 years. I do have a book. I kind of took what I learned taking care of patients, and I put this into a book called The True Definition of Beauty. It talks about how the human brain processes the face. What do we see when we see each other, right? And so you can get that on Amazon. And I do speak worldwide, and I do have people that come in from all over. I have a patient who was in recently from New Zealand, actually. Okay, let's click here. There we go. This was me on Dr. Oz, and those things that form on the cheek, that's what I got known for. They're called festoons. They were a difficult problem to treat, and I was able to perfect these laser techniques for this. And I was on the Dr. Oz with this woman, Erin, as well. Same thing there. I was able to help her with those festoons that formed on the cheek region. So this is my practice. People fly in from all over the world, and so I'm going to go into now. I want to thank Dr. John Harmon because he actually helped me to develop these slides. So we're talking about, let me move these, hold on a second here. Okay, good. So how does this work? I want to go back. There's this initial study that was done by Drs. Connors, Yu, Eckhoff, Wagner, and Chang. They did research that was published actually in 2021 in Internal Medicine Research about double-blind testing of LifeWave's X39 patch to determine GHK-Cu, that's copper peptide. And they were looking at, does this patch actually increase copper peptide levels? Okay, and we're going to go into this. So this was interesting. It was a double-blind, random controlled trial, explored the impact of wearing this non-transdermal patch, meaning there was no medication going through the patch, over a period of about a week, and they looked at the blood and urine over that time period, and they went to see what happened. And it was actually so revolutionary that they actually presented it to the patent office for a patent of this. That's how amazing it was. And they had 60 people who were randomized into two groups, and they found a significant increase in the copper peptide in the group that was wearing it as compared to the people who were not wearing it. They then looked at the end of the study, they found the same thing. So, okay, let's talk about this. What is copper peptide? So this was actually first identified by Dr. Lauren Picard in 1973. I think it's so revolutionary that Dr. Picard probably should get a Nobel Prize for this in the future. It belongs to a group of emergency response molecules which are released during injury that comes to the body's age, and it's naturally sent to any injured tissue. And it's been shown to have a therapeutic role in age-related neurodegeneration and cognitive decline. And this essentially actually improves axon survival and the maintenance of nerves as well. So it activates stem cells. It accelerates the speed of wound healing. I'm going to show you that actually in photos that are coming up later in this presentation in my own patients. It helps with improving skin, improves skin firmness, depth of wrinkles, smooth, rough skin. It is antioxidant and anti-inflammatory. Who could not use some anti-inflammatory? I can. Anyone else there? Anyone else can use anti-inflammation? I can. Right? It is important. We find that inflammation is a big part of aging. So if we can find, especially a non-invasive way to help improve our inflammation in our body, this is amazing. So this is what copper peptide, I'm not talking about the patch right now. I'm saying if there is a way somehow that we can increase copper peptide in our body, these are all the things that increasing copper peptide can do, okay? it beneficially alters the expression of human genes involved in neuron function, okay? And it's very strongly anti-anxiety, anti-aggression, anti-pain within 12 minutes. And I'm going to talk about this too. This happened to someone I know. And when we get hemorrhages in the body, there's something called apoptosis, which is sort of a cell death that happens when we have a hemorrhage in the brain. And if someone had high copper peptide, they had less neuron death in the face of a brain hemorrhage, which is amazing. It's been implicated in resetting 4,190 some odd. Let me see if I can move this here. Here we go. Yeah, let's move this over here. 92 genes to a younger, healthier state. There we go. And this is interesting. For chronic obstructive pulmonary disease, it's a lung disease that people have. It's the #1 bioactive compound that's recommended for this. And it resets programmed cell death in several types of cancer. Now, we're not saying, okay, that this can actually cure cancer, but this is what the research is showing. And interestingly, a cancer cell, well, we have cells next to each other. We have like a center cell, one to the left, one to the right, one above, one below, one in front, one in back. The cells actually control one another. They tell that cell to stay where it is. In cancer cells, that cell loses that signals and starts to replicate everywhere. But what this can do, it actually can reprogram that cell. Don't do that. That's what this is showing, to act like a normal cell again. It's really amazing. And it has not been shown really to cause any side effects or issues with people. They actually found people who had damaged spinal segments in the neck. They actually injected the copper peptide in the skin around that area. And they found that it actually helped those spine segments heal faster, which is really amazing. And this is a little complicated, but they found for people who had, let's see, alginate hydrogels. Okay, so for people with broken bones, they would put a gel, okay, over this. If they had a lot of copper peptide in it, they found that the bones actually healed faster, which is incredible. This actually happened with my own mom. My mom fractured something in her back. We put her on the patches. She was in this brace that was supposed to be in there for about 12 weeks. And under the effects of the copper peptide, within probably about a month, she was able to be out of the brace and her back was doing well. It was really amazing. Increase the healing for many tissues, skin, stomach, intestine, bone. It's strongly chemoattractant for capillary cells, mast cells, and macrophages. So if we have inflammation in the body, it's saying, okay, guys, come here, come to me, come mast cells, come capillary cells, let's build some vessels here, let's heal this area. That's what we're talking about here. So if there's some way that we can have elevated of copper peptides, I'm not sure if there's anyone in the audience here knows a way we can increase copper peptide, but if we could find it out somehow, right? If we could figure it out, it does all these amazing things, okay? It activates genes in something called the ubiquitin protease system. So we have a set of genes that cleans out cellular debris. If somehow we can have high levels of copper peptide in our body, it increases cell cleaning in the cells. Incredible. Cortisone is steroids, and it's used to decrease inflammation. But one thing we've seen is that on its own, it actually prevents regeneration in that area. It kind of suppresses all activity. If we have high levels of copper peptide, though, it blocks the cortisone's ability to cause anti-regeneration effects. So we can have a lot of healing in the effect of steroids, which is really incredible. Fibrinogen is something that's known as a very top predictor of heart disease. Heart disease is the biggest killer of men and women in our country and really worldwide. And we can actually, if you could somehow have high levels of copper peptide in your body, it will reduce the fibrinogen synthesis, meaning that you'll have less issues with heart disease. And this is another thing, it increases myostatin gene expression about almost tenfold, 9.4-fold. And myostatin inhibits heart failure. So if you could somehow increase copper peptide, increase myostatin, you'll actually have a reduction in heart failure as well. So this is where it's coming from. There, you can look this up. There's something called PubMed.gov. It's actually a repository for medical data, medical studies. You can look this up on your own. If you put in GHK, Cu peptide, copper peptide, there's 124 papers on this. So there's real science behind this, okay? And this is where we talked about some of these things. So copper peptide, they looked at scald wound healing in mice and increased angiogenesis, the increase of vessels going to heal this. This was another one talking about how with COPD, chronic obstructive pulmonary disease, it was helping that. And they can actually suppress molecules thought to accelerate diseases of aging, such as neurofibrillary kappa beta, and it's anti-injection, anti-pain within minutes of putting it on. We'll talk about that. So it was actually seen that the concentration in the blood was seen in a statistically significant difference from day 2 to day 7 in this study. Okay, so it was real results. So we put on the skin, what happens to our skin? So this idea of photobiomodulation. Our bodies are meant to work with light, okay? One of the ways we do this is actually through a UVB. UVB will come in and actually will help us in the production of vitamin D in our body, okay? Vitamin D is really, really important for our health, and getting sunlight is one way that our bodies is already programmed to work with light. So genetically, we are set to take light, invisible light, okay? UV we can't see, and make something from it, okay? This is the same way that the copper peptide works too, okay? Talk about this. So once again, I was showing you here, it looked at wound healing, depth of wrinkles, programmed cell death, repairing damaged DNA, the neurofibrillary kappa beta, which is believed to promotes cancer growth. If you have high levels of GHK or copper peptide, it inhibits cancer growth, okay? COPD it's useful for, superoxide dismutase, COD1, it helps that as well. Neuron function increases neuron function by 50%, anti-pain. I talked about how it helps people with cerebral hemorrhage, with neck issues too. There's a patent on this, okay? So converts old liver cells to younger cells. It helps with wound healing. I'm going to show you that myself, and resets our genes back to a younger state, okay? It can be used anywhere on the body, but the initial places where it was put was actually the acupuncture meridians, back of the neck or underneath the belly button. But truthfully, you can put it anywhere on the body and the stem cells know where to go. So if you feel better on your hand or on your wrist or wherever, you can put it anywhere. Okay, this is where the studies were done initially. So it's applied to an area such as pain. And what happens is we put out infrared energy. It's the heat energy that we put out. I put out a lot of heat. My wife likes to come next to me in the bed because I put a lot of heat out. I can warm her up. And it's kind of interesting. It's like, why do we spend a lot of energy making, these infrared rays? It's kind of interesting how we do that. We put it out into the environment mostly. So what we're doing here is we're capturing a very small amount of it. And the patches have these nanoparticle crystals in it. It's almost like a mirror, and bounces the rays back into the body. These ultraviolet rays, these heat rays, bounce back inside the body. And when it comes back there, it activates and increases copper peptide. And that causes a myriad of different effects, one of which is increasing stem cell activity. Okay. Move it along here. Okay. Oh, let's go back. Hold on. This will come up. One more picture. Here we go. Yeah. This is interesting. They actually did this in Japan in 2009. They found in a really, really dark room, okay, we actually glow, okay? We are actually, these souls in our body and we put out energy or light. And we can't see it, most times, but in a very, very dark room, we could see each other actually glow, which I think is really impressive. Benefits. We can actually increase this copper peptide. We've shown that for this study, and that has all these downstream effects. It can activate stem cells, and the benefits are really amazing. Immediately, we can have decreased inflammation. We can have more energy. People express that. Better sleep. A lot of people are remembering their dreams. I don't know if, Stacy, you've seen that too. People remember their dreams when they wake up. Very interesting.
That and very vivid dreams during dream state.
Very, very, very true. I've seen that too. Yeah. Pain relief. This is interesting. Okay. I'm including here a text thread from someone. Hold a second here. Can someone click that? Start recording. Okay. Okay. So this was my friend Alan, and he actually had issues with back pain. I didn't know. We were actually talking one of the weekends. We're busy doctors, so we can't talk during the week. It was a Sunday. We were talking about something called exosomes, which is a way to actually speed up healing. We were doing studies on that. And so we were talking about that. And he said, Adam, I'm really having problems with my wrist. He says, I'm actually going to have carpal tunnel surgery. And I said, Alan, let me send you these patches because this might speed up your healing from the carpal tunnel surgery. So I sent it up to him. We sent it out Monday, got to him Wednesday night. The first time we put it on was Thursday. He didn't tell me, but he was having problems with his back. Okay. He had a lot of problems with his back. He actually went to his doctor the Monday before and was having steroids injected into his back to try and reduce the pain that he had. Interestingly, he said that, he put the patch on around 7:15. He said about 3 hours later, his pain was down 75%. He was jumping around the operating room. He didn't know, all the nurses were commenting on it. He says, I don't know what the F this is, but I am never taking this off. I said, Alan, you do have to take it off. It's 12 hours on, 12 hours off. But it's interesting. Now it's about a year and a half later, he actually canceled his neurosurgery appointment because his back is doing so well now on this. So if I can get to this, I wonder if I get to this, deny this. Let me go back, sorry. I have this thing in the middle of my screen that I can't see too well. Okay, so it helps with skin, with collagen in the skin. This is Mandy showing her improvement in her skin over this time period. Is there a block in your image or you can see it fine?
We can see everything perfectly fine.
Okay, I just something in the middle of my screen. Someone wanted to receive a request to record on the cloud.
Oh, deny that. Make sure you deny that.
I can't really get to it, unfortunately. I don't know.
Okay.
Anyway, moving on. They found with injuries from sports as well, it's helping people heal because it's really an injury response molecule. It makes sense, but it helps people with sports performance after exercise. Hair growth, this is amazing too. That's been helped this. This is someone, her dad from Toronto. You can see the hair growth that happened after 6 weeks of being on the patch, kind of amazing. This is a couple different slides. I like this one on the right here. This guy was working on rafters, fell through the ceiling. He broke 6 ribs, punctured his lung. They expect his recovery to be 6 weeks. He was back to work on the patches in about 3 weeks. I was saying this happened to my mom when she had a fracture of her L4, L5 in her lower back, and she was in this brace supposed to be for like 12 weeks. After like 4 weeks, she was out of it and she was back on the treadmill again. It was kind of amazing. This is showing radiation treatment to the face and how it's sped up healing after radiation treatment for the skin. This is interesting. So our brains, okay, they've looked at brain inflammation. We should have sort of a balance between kind of activity and quietness in of our brains. And they found with time with this copper peptide, we actually had regulation in the activity of the brain where it's more even keeled, if you will. For scar removal, this is amazing. This was actually someone who had a bypass, I believe. And look at July and look at August. In 1 month, you can see how that scar improved because there was inflammation there. That's where the stem cells went because there was inflammation in that area. This is another one showing I was healed. And she has the patch on the foot. As I'm saying, you can put it anywhere. The stem cells know where to go. Okay, you can she put it on the toe. If she put it on her back, they would have gotten there anyway. But it's fine. It can be used there too. Wound healing. This is amazing. I think I'm gonna go through this. Okay, so this is a surgical scar. This is after 2 weeks. Now, I do want to say what's probably happening here is the same thing what happened to, so Alan, who I told you his back felt better about 3 hours later. Okay, stem cells are not getting there that fast, okay? But the anti-inflammatory within 10 minutes that I was telling you about, that is why his back felt so much better within 3 hours. That's the inflammation. The same thing's happening here. In 2 weeks, we don't have stem cells rushing that fast, but the inflammation it reduced actually helped this be better in about 2 weeks. It resets genes back to a younger state. Okay, so I wonder if I can somehow get this. Hold on a second here.
So maybe if you stop screen share, deny it.
Yeah, I'm gonna do it. I'm coming back. Yeah. Okay, better. So I have a worldwide practice. People come from the world. Why in the world did I start using this in my practice? What is a surgeon thinking about doing this, right? So I've been using laser technology, okay, to drastically improve the appearance of aged skin. However, the initial healing time for this procedure takes about 10 to 14 days in most cases, and a few months for full recovery. Here are some patients before and afters, and this is what I do. You can see the depth of the sun damage she has. You see it in the forehead, the bags in the lower lid, right? And so I do this, but this takes time to heal. Here's another view of her. You see how it just looks like she looks like the younger, maybe daughter of that person, but it's really her. And this is what we're able to do. We're able to remove sun damage, allow the body to heal itself. And when it heals itself, you actually have brand new skin there. This is great, but it takes time to heal from this. And that's why I started looking at, well, how could I speed up healing? I actually did some research over the years. I found that initially I was doing a study. I found a guy came to me from Santa Monica. He was actually the CEO of a company called Sky Orthobiologics. They used banked amniotic stem cells for helping with wound healing from infections and things like that. He flew out. He was the CEO of the company, and he said, "Can I use this for the healing?" I said, "Yeah, if we do one side, because I wanted to see if it worked." And we injected it on one side of the face, and it absolutely sped up healing. That was where amniotic stem cells. They were expensive. They were thousands of dollars for those stem cells. Okay. Here as well, you could see those are the festoons that form. You see those bags under the eyes, and you see how it's tighter afterwards. So we can do this, okay, but it does require some healing time. And I was searching for ways. So that was one thing. Those amniotic stem cells actually got me thinking about this. When I first heard about X39, how it could help increase stem cells naturally, that piqued my interest because I knew how the amniotic stem cells worked. And actually, truthfully, when the amniotic cells were put in the skin, they put out something called cytokines, which is sort of like homing beacons. And the person's own body stem cells came to that area. Okay, that's why that worked. Those stem cells from another person didn't really heal them. It was the homing beacons they put out that actually helped them heal better. Here as well, you can see, we can make, we feel kind of looks like his younger brother, right? Younger brother, older brother. And once again, I can do this, but it took a while for people to heal. People would say, look, you have all this damage on your skin. Is there any way to reverse it? Yeah, this is what I can do. I can reverse the damage here and get the skin to come back as younger, healthier skin. And until I found X39, the healing was taking 10 to 14 days initially and a couple months for full healing. Here's another example. You can see how her skin just looks much more youthful, around that area, the eyelids. This is what I was talking about. You see the eyelid skin is tighter, and that's what Stace was saying initially. I've been figuring out ways to use the energy to improve the eyelid skin to make it tighter afterwards too, and I'm getting there now. This is her straight ahead. Okay, so this is what I was talking about. I've done studies. Amniotic stem cells worked. Hyperbaric oxygen. Hyperbaric oxygen. We actually have a tank in a place in my town. We put people through the hyperbaric oxygen. It increases healing and helps people heal faster. But that has cost to itself. And then we have our X39 stem cell activity patches. Okay, so let me show you this. Now, this is my experience, okay? I can't say this would happen for everyone else. I can't promise that X39 would heal everybody, but this is my experience that I'm sharing, okay? So we don't say that LifeWave treats specific diseases, okay? This is just my experience. Like, you really have to talk to your own physician about these things, okay? Okay, can you see these three pictures? This is three different patients who had the full face laser I call reset, reset skin. And the woman on the left did not have the patch. The woman in the middle, the woman on the right did have the patch. This is them beforehand. Let's watch what happens, okay? This is 6 days after surgery, and you can see how they're going through wound healing. The woman on the left, okay, she has that redness to her skin. You see the yellow under the eyes. That's all normal. There's nothing wrong with that. There's no pain in this. On a scale of 1 to 10, in any of these cases, it's about 1 or 2 out of 10, which is nice. But they have to go through healing, okay? Look at the person in the middle and the person on the right. They don't have the same sort of redness or yellow to the skin. Can you appreciate that? This is just 6 days after surgery, which is pretty soon. These two people, the middle on the right, is really abnormal for my eyes. People shouldn't look this healed at 6 days, okay? This is they look to me like patients 10 days after surgery. Let me show you 4 days later. This will be 10 days. This is 4 days later. The woman on the left is looking better, right? Look at the woman in the middle and the woman on the right. They look so healed at 10 days. So they look almost like a month after surgery at 10 days. This is why I started using these for my patients. And now all my patients are going through this. And this is the comparison. These are 10 days with the patch. And it took this woman 5 weeks without the patch to look like they looked at just 10 days. Okay, let me show and share some of the results my patients are having, okay?
And thank you so much for sharing your story with us.
Can you hear that?
It's my pleasure.
We got you actually on the X39 beforehand also, right?
I love the X39. I've been on the X39 5 weeks prior to the surgery. And even up through the surgery and even in recovery, I really think it's helped me heal faster.
What else did you notice with these seven?
So I'm 52. I wake up in the morning, I'm a little achy and ouchy. Yeah, that doesn't happen anymore. Now I'm X39.
It's amazing. So all the stem cells that generated is actually helping to with your pains and such, and then also helping to heal the face faster.
It's again, anybody who's thinking about having this done, the X39 definitely helps with the healing. And this is the best doctor in the world to go to.
Thank you so much.
Okay, we should another patient. Hold on.
Hi, Dr. Scheiner here. We have our lovely patient Lisa here. She's 3.5 weeks after her procedure.
I had upper and lower blepharoplasty and a full face reset.
And you mentioned that you had found some other things about the healing patch that we put you on.
The earliest symptoms I would ever have of being pregnant is I would have this terrible rigor. Being compliant, but also very skeptical, I did start wearing the patch just because I did want to heal as quickly as possible. And I would say after 7 days or so, my stomach symptoms just stopped. I've continued to wear CPAP only because that had helped me keep my stomach acid down. I found that I haven't needed it anymore, and that my stomach acid now is not bothering me.
That is amazing. This was something that was bothering you for up to 30 years or
About
something.
30 years.
So it's the little patch that could.
I came for the procedure for my eyes, and I've kind of reached out to a couple of people that I talk with on Facebook because they don't know what to do about those festoons. And so I thought, well, while you're there, you might as well just go for that whole. I told the whole shebang, and I'm happy I did. Honestly, yeah.
Well, thank you so much for sharing what you just said and about the patches. And we're just so excited to help you as a patient and what this is doing for you. So thank you for sharing.
Okay. Very good. So I'll be open to questions here. If you were interested in the book, you can find that on Amazon. You can take a picture of this if you want to follow me or DM me on Instagram. That's my address. You can do that. And I will stop the sharing. Where's my mouse? There we go. Stop share. Okay. Very good. And let me make sure you're the host now again, right?
I have host abilities. Yes, I believe.
Okay. Okay. So questions that people have, I'm here.
Wonderful. Fantastic. So I've been taking some notes throughout of some questions they had as they were rolling through, and I'm getting another person to ask the same question. So we're just going to start with this. So lipedema, stage 3, they're wondering if obviously we cannot discuss any specific diseases, right, to make any claims to treat or cure anything. But based on your experience with the lymphatic system, you obviously work very deeply in that system with what you do with the body in the face and healing. What would you share with these people? Because I've had several people ask me about that tonight in the chat.
Right, for lymphedema. So that is, let's talk about this once again. This is a molecule, if you can increase copper peptide, which the patch seems to do, copper peptide will go with any inflammation. Lipedema, that edema is inflammation. So it's something that can't promise, but should be able to help as well. Yes.
Perfect. So let's do
And I would say one thing, it's very exciting that that woman was 1 week, and you understand, for 30 years, she had gastric reflux, 30 years, and 1 week on this, and her GERD was gone. I had a woman who had a tendonitis in her hands about a month after surgery. She was opening and closing her hands in front of me. She's like, what did you do to me? I said, I don't know. She said, no, look, this inflammation is better. And then we had a woman who had this rash for 2 years, something called an annular rash, little spots over the body. She went to 2 dermatologists. They couldn't figure out what to do. It's going on for 2 years. She goes on this after about a month on the patches. They start a month before, and they're on it for 6 months after. That's what I require for the procedures. A lot of people keep it on even after that, but that's what I require, but 7 months total. So the month before, and all of a sudden her rash is better. And so inflammation, what could help. So in terms of lymphedema or any sort of arthritis, that's what this can help.
Wow. That's fantastic, because I know initially you had said last year 1 month before, 2 months after, so that we get like a 3 months. So now you're saying a total of 7 months, because you're seeing such huge changes in your patients from that time frame.
Exactly right. You're right. We did change that because we're seeing so much more healing that way.
I love that. So someone wants to know, how much does the face reset? How much does that cost?
You would have to contact us. I don't want to put this out there that way. But if you contact us, we give information, but it's really, I love doing it because we can take, older skin and make it look younger. And there's actually health benefits too. But the fact that we can, make skin younger that way, and then everyone starts with this new healthy skin is just wonderful.
Wonderful. Thank you. How about eyelid fat?
Yes.
39 help with that, or is that something we need to take out?
I think that's something that has to take out, because it's not necessarily inflammation that's causing that. It's more of an aging structural change. It has to do with a membrane that holds back the fat that that will come forward as we age. If it was inflammation, it would help that, but that's not really the mechanics behind it.
Okay, that's good to know, because you always, you see people's eyes as they age to get the droopier on the top and whatnot. So
Right.
Someone wants to know, what are the downsides of wearing this patch longer than 12 hours? Should we wear it longer than 12? Can we wear it? Why
Great question.
12?
So there's no downside, okay? But there's almost like you want to restart the system, okay? You don't want to be habituated to it. So the reason we say 12 hours on, 12 hours off, you want to increase the stem cell activity, okay? Increase the copper peptide, and then take it off. And then we re-stimulate it again the next day and take it off. That's the idea. But you could do the following. If you had like a pet or something, you could take the patch off you. You can put it under the collar of your pet. It can help your pet for those other 12 hours. Yeah.
Perfect. I love that. Help that pet out, right?
Right.
Okay. How does it affect hair growth? Which patches would you recommend, especially for females? Does it impact hair growth that you find?
Yeah, well, interestingly, if you saw that photo, that was just the X39. That's like the main, big daddy, because the copper peptide causes a myriad of different effects.
Yeah. Okay, so perfect. All right, so what about any success with patching with like lazy or droopy eyes? Do you see that at all? Or is that a surgical procedure as well?
Yeah, that's really, it's not the mechanism, it's not inflammation that causes that. So I haven't really seen that work. We do have eye drops that actually raise eyelids, and we do surgeries to help that too. Yes.
Okay, that's good to know. All right, so what about placement of these patients that are wearing the patches before and after? Are there specific, obviously they're not patching on their face.
No.
So can you talk about placement? You know, everyone thinks that a patch has to go on location in order for it to work on that area.
No, it doesn't work that way. The patches will increase a copper peptide wherever you put it, and then the stem cells get activated there. They look for inflammation. Whenever there's inflammation, it's put out these things called cytokines. They're almost like homing beacons, and that's what the stem cells will go to. They're looking for inflammation in the body. So, as I was saying, traditionally it was done on the acupuncture meridians, so that's why they had it there. That's where I tend to wear mine too. But sometimes I was forgetting to take off the patch. I put it on the back of my hand. Just that way I remember to take it off at night, and it works there too.
I love that. Yeah. Sometimes when you have it in a place where you can see it, I know during presentations, I'll have my patch right here and everyone messages me, what is this patch? What is this patch? I'm like, it just, whatever I grab out of the bag, it doesn't matter. It's just so you guys can see it, but it's
Yeah,
same thing here. That way, remember to take it off, right? You're never going to forget that when you look in the mirror. So
right.
people want to know, what about other patches? Is there ever a situation where you recommend or you have patients that are using other patches outside of X39, or is it only X39?
We are trying to keep it simple. So we start with the X39 that causes the most healing. I do like X49 as something that goes along with it. Alvita, which is a really interesting patch that increases epithalamine, works on the pineal gland. It's greatly affects oxidative reductase throughout the body, and that indirectly helps the skin. So we like the Alvita too. And patch is another great one. The LifeWave is really cool for people. Like, yes, we could talk about so many different ones, but I'm trying to keep it really simple for my patients, and it's causing all these amazing effects. So that's what we're doing for patients. But once they're on it, sometimes we will talk about other ones for them. Yes.
That's good to know. Someone would like for you to explain a little bit more in depth about the inflammation in the body, because that's a huge problem that so many people deal with. So can you go over that part again a little bit more in depth?
Absolutely. Inflammation, it's not good for our long-term health. Okay, there's a certain amount of inflammation you have to have, like with an injury, right? But when you have chronic inflammation, that's a problem. That's going to cause things like arthritis. You can have inflammation around like the joints, and sometimes around the nerve roots, and so that can cause a lot of disability. The one thing that's nice about inflammation is that is where stem cells want to go. If you could increase stem cell activity somehow, Stacey, do you know if we, do you know a way we can increase copper peptide? Do you know somehow we could do that?
I think possibly this patch.
Oh, I've heard about that. Yes, the patch, the X39. Yes, if we can increase copper peptide, it increases stem cells. They go to areas of inflammation anywhere in the body. They will go, and it will start healing. Now, I was trying to say this a little bit before. It's great that my mentor, this person, Alan, in 3 hours got better. That's inflammation. That's really the anti-inflammatory part of it, which happens within 10 minutes. That's not the stem cells yet. There are people that can take 6 weeks, 6 months to have results. It is nice to have people at a week, a month, but it can take longer. Sometimes it's healing things in the body that we're not even aware of. I knew someone who went to the dentist after being on the patches for number one. Said, "What happened to your gum recession?" She's like, "What? Yeah, your gum recession's better." What? So it can heal things in our body that we're not necessarily aware of. But we often say, we want to keep using it. We don't want to stop it before the miracle happens.
Yeah. A lot of people ask about that. They want to know time frame. How long is it going to take for this? How long is it going to take for that? And we're all so different, and our body responds differently. Physically, mentally, emotionally, everything's different. So
And I would say, yeah, Stacey, I would say it is healing something, maybe just something you're not aware of. It could be something inside the body that's helping first before it helps the thing that we think that it needs to help with.
right, we're always like, get rid of this problem, fix this XYZ issue. And your body's like, oh, I'm sorry, honey, you need your liver fixed first, or we need to go right to the, the kidneys. So you can't direct where your body cells go to heal. You have to be patient with the process. So let's
Right.
talk a little bit about contraindications. As a medical doctor, you have to be very concerned about that in your practice with what people are taking, the medicines and whatnot, what they're doing when you're performing any kind of procedure. So what do you find with the patches and contraindications?
They're really, in terms of medication, I really don't find any, honestly, because it's sort of synergistic with things that people are taking. The only things I would say is that if someone is pregnant, we don't have any data to show what it does. So I wouldn't necessarily recommend when someone is pregnant to be on it. The second thing is someone is actively going through chemotherapy or radiation. Like on the days they're on the chemo or the radiation, I don't recommend that they be on it because we don't know what it does there. In between it, when they're not having the radiation or the chemo, I'm okay with them that time, but just not when they're doing it. Those are the only two contraindications that I've seen. There have been cases, we kind of talked about it, that there's been no bad side effects from using the patch, but there are some people who have a lot of, let's say, damage to their body, and sometimes putting it on, they notice more effects, and sometimes they can't use it 12 hours. Sometimes we have to take it off. They have to use it like an hour a day for a couple days, then 2 hours, then 3 hours. They have to work themselves up to the 12 hours. And that's something we found with certain people too, have a lot of damage in their bodies.
Yeah, when people can't eliminate toxins correctly, then when you use the X39, we know it does elevate your glutathione about 30%. And so that in and of itself, if you're not used to detoxing, that may be a little bit of a detox for you in your body. Maybe like, whoa, wait a minute here. This is a little much. So if this anything, get on your detox game, like get the toxins out of your body, eat clean, drink clean, and do everything you can to keep that inside as healthy as possible.
And do sauna.
Yes. Oh my gosh. Yes. Sauna. We don't all have hyperbaric oxygen chamber therapies, at our house, those chambers. I wish we did sometimes. I had to sit in one. I had 62 dives with my daughter back about maybe 12, 13 years ago. We did 62 hours in a chamber. And of course, she had 100% oxygen, on her hood. And I was just compressed, air down about 16 feet. But I could tell a huge difference back then. And I didn't even I knew the power of it just from reading, but the power for her was to, and me as well, really help that bone marrow create new stem cells for healing. And that those effects are long term, but like you said, it's so expensive and time consuming. That was over a 6-week period of time. You can't do that, just 62 hours in 1 week. So, that's definitely not easy for many people where we look at this and it's so simple and easy. So
Yes.
they're asking a few more specific questions, and I don't know how specific you want to get with this, but they're asking a little bit. I know you just mentioned, if someone is going through treatment and they're doing radiation or chemotherapy, we don't have any contraindications. We've had tons of people that have patched during that, but sometimes people don't do it on the days of. We can't make any claims that this is going to cure or treat any type of cancer at all. We never would, right? That's unrealistic. But, let's go back, Dr. Scheiner, to getting the body in balance, helping with, you elevate GHK, you elevate these master cells, you help the body to reset. Can you kind of just give a general there so they can understand, diseases are diagnosed by doctors, which we need them sometimes, but the body
Right,
doesn't recognize that.
Right. In terms of, cancer, these sorts of things, we can't make any claims about it. And so we're just trying to be careful. That's the thing. We don't have any ideas if it's hurting or helping, but we don't want to chance that. That's why I'm saying like during active chemo, I don't suggest it. In between, I'm totally fine with it. Same with radiation. We don't have any data showing specifically that it helps with cancer, but it in my mind, it makes sense that if we can have stem cells that are at least helping the inflammatory part of it, that it could be helpful. That's what I think.
Okay, perfect. Now, I know you mentioned earlier someone with tinnitus, but what about, let's go up to tinnitus. Let's go up here and talk a little bit more about brain stuff. can we talk a little bit about sleep apnea, a little bit about the ringing in the ears, a little bit about, memory and brain fog and, those kinds of things would be a little bit more neurological. How do you feel about the patches with that?
Yeah, there's actually been research. They're looking at diabetics actually initially, looking at nerve regrowth after diabetic neuropathy, and they found when you had high levels of copper peptide in the body that those nerves would regrow. If we can then think about that in terms of the brain, it makes sense that it should help that as well. And they have done some brain studies, as I was showing briefly, looking at the balance between activity and quietness of the brain. And they found that it wasn't overnight, but after using it for a while, those brain activity actually improved to a more homeostatic sort of state.
Wow. Okay, that's fantastic. So let's talk a little bit about the laser therapy or red light therapy, okay? Infrared saunas, things like that. So
Yeah.
are we okay to patch while doing that? What are your thoughts on using them together?
Absolutely, I do. We actually we put a 2-story addition to our home recently. I actually put a finished sauna in there, and so I wear my patches when I'm sauning. There's no problem with that.
Yeah, we do too. We have an infrared sauna here at home, and we don't have any issues with that either at all. What about if someone's had like a major surgery? We were talking about the face surgeries. But what
It could be
about
anywhere, yeah.
bigger surgery, hip surgery, heart surgery, things like that?
Yeah, once again, I think that those are all states of inflammation, and if this can be anti-inflammatory, that could definitely be helpful for, after a hip surgery or knee surgery or abdominal surgery, anything where there's a lot of inflammation. Increasing copper peptide, which increases stem cell activity, is a good idea.
I think so too. So Lois asked, how much GHK is actually increased with X39, and what are before and after concentrations? And Lois, we have a lot of clinical studies, over 90 of them. They're on a website, startx39now.com. And if you go to them, you can see the clinical studies on the X39 and the elevation of GHK and the double-blind placebo-controlled studies. But Dr. Scheiner, do you have any way that you measure, or have you ever measured GHK? I know I don't, but do you have any?
That would require urine and blood testing. So I was looking at the studies that they had. And honestly, I was a little bit skeptical at first when I first saw it too. And then, my mentor, Alan, was the first one I heard about. My wife had improvement with her arthritis. Then I did those studies on the patients, and I started one a month before just to see what happened. And it blew my mind. So something is definitely happening. And now I'm hearing all these stories from patients about all the things that it's helping. So that's what's really encouraging me to use it. But I haven't done the initial blood levels and such. I'm really relying on the studies to see that. But irregardless of that, the fact that I'm seeing the results with my patients, that's why I'm recommending it.
Yeah, I agree. And so someone else kind of along those lines was asking about if you keep using X39. Now you've been using it for about 1.5 years, is that correct?
Yeah, about 1.5 years, yes.
Yeah, and I've been using it about little over 3 years. So do you keep getting younger biologically and heart-wise and everything else? Does everything else continue to reverse age?
I think what it does is having a high level of stem cells in the body is helpful. We're going to continue to age, but maybe we can age in a better way, with less inflammation.
Yeah, absolutely. And being able to, I know a lot of us have our biomarkers tested, and so we can see our chronological age versus our biological age. There are a lot of people that have bioresonance devices that look at that same thing. And so we do have people that can say, yep, I'm this age, and yet my chronological age is saying this. So
Wonderful.
I mean, I'm all about being able to keep what's inside healthy and vital and prevent anything possible. When you have bodies that are functioning correctly, you have less opportunity for things to go wrong. So,
Yes.
All right, let's go a little bit more back to the skin. Does X39 help with the skin? I know we talked a little bit about the collagen. How does that work with the X39?
It does. And that one woman, I think it was Maddie, that I showed those photos, she did it for about 1 year and her skin definitely looked better over that time. I will say it really depends though. It's like in certain persons, maybe in her case, there wasn't a lot of inflammation elsewhere. So the stem cells went to her skin first, right? For someone else, it might be helping out something out, first before it gets to the skin. But Over a long term, though, I think it can make improvements, in the skin. The epithalamine that happens with Alvita, that is indirectly helps skin by decreasing the oxidative reductase throughout the body. So that's another one that we use.
I love that. So what about, Deborah's asking, I've heard osteoarthritis is not inflammatory. Is that correct? And if so, can X39 help with that?
I think it's not all or none. It's not like osteo is nothing, right? There is some inflammation with that, so it can definitely be helpful. There have been people with issues with having little cartilage in joints, and after a while of being on the X39, they'll actually regrow some cartilage. And if you think about it, the first time they ever generated cartilage was in utero, and there were stem cells that were involved with that. So if there's inflammation there, that's where the stem cells are going to go, and they're going to stimulate the activity there to regrow that. Once again, it's not necessarily overnight, but over months or so, we can actually see improvement. So I think someone with osteoarthritis, arthritis is inflammation. I think it's definitely something that they could definitely try, and I think they would see improvement with it.
Fantastic. What about internal scarring from surgeries? Do you feel like this technology helps with internal scars?
If it's inflamed, yes. If it's an old scar, probably not. But a more recent scar that's going on, yes, it could definitely help with that.
Okay. Someone's wanting to know, do you sell these in your practice retail, or do you have your clients sign up wholesale? How do you do that with them?
Both. We have them in the office. We sell them in the office for a little bit of a profit, but we really try and get people to get them on their own, especially with the patients that are coming in for surgery. Certain people come in, they're like, "Yeah, I wasn't sure," and then I tell them about it. They're like, "Okay, I want to get it," and so we have it in the office to give to them, prior to the procedure. We like better if they start like a month or so before, though.
And why do you feel like they need to start a little bit before? What do you feel like that does for them?
I think it really revs up the stem cells. They're more active, for them. And so I think I've seen the best healing for people if they've been on it for a couple weeks before the procedure.
Nice. No, it's interesting. Laura, who you met earlier, right when
Yeah.
we found out about LifeWave, she was getting ready to go in for a hip replacement. So she only had 2 weeks to patch. And she saw the same thing. She should have been black and blue from hip to toe. And she came out of that thing with 0 bruises and 0 issues, complications, nothing. And she'd only had 2 weeks to patch ahead of time.
Impressive, yes. That's what copper peptide can do. Yes.
Yeah, just so crazy amazing how that works. So, Dr. Scheiner, I just would love for you to spend the next couple minutes if you want to, just share anything with our viewers and those that are watching the recording as well too. Anything at all about this technology that you feel would be beneficial to them. We are just forever grateful you took the time to be here tonight.
Oh, it's my pleasure. My pleasure. I was using it mainly to help my patients heal faster. That's the main thing I was looking for. But it's so interesting now, especially as we're using it about a month before, we're hearing stories from all these different patients about the many myriad of different things that it's helping. And so can anyone use this? Really, anyone can use this. We don't really know where the inflammation is in our bodies. So it's something I think that everyone can be helped with. And I would say, yeah, if this was like $4,000 per batch or like an injection, I would get it. But I don't think it's, at $100 a month is what we're finding this when you sign up for it. I think that's reasonable for all the effects that it can have, and it's helping whole families this way. And so, I think it's really interesting. I did put up my information on Instagram there. If people have other questions, they can DM me there. And it's been a pleasure talking to you and to everyone here.
No, thank you so much for being here. Thank you for your presentation. The information that you shared is invaluable. I will upload this to my YouTube channel. Of course, I'll send the raw copy to your email, Dr. Scheiner, but I will include your website on the YouTube. So if anyone wants to get a hold of you, contact you, they'll have the website on there as well. So you'll be able to get that contact information.
That's perfect. Yes.
Well, thank
Very
you
good.
so much again. I look forward to seeing you at convention.
Yes, at some future meeting, we'll say hello again. Yes.
Yes. I'll see you at convention. Thank you, Dr. Scheiner.
Okay, guys. Bye.